Welcome back to Canadian Justice, where we're discussing the move to expand non-government healthcare in Ontario and potentially in other provinces. So, Dr. Whatley, in the last segment, we talked a little bit about this proposal by Premier Ford to expand non-government healthcare. Can you detail a little bit what exactly is he proposing, and are other provinces doing the same thing?
So really all he's doing is shifting services out of hospitals. And we've been doing this since the 1970s. So in 1976, 45% of healthcare spending went to hospitals, services provided in hospitals. In 2020, only 26% of healthcare spending went to hospitals. So we've been moving services out of hospitals for decades. Currently in Ontario, we have over 800 independent health facilities. And the Auditor General report in 2012 found that services provided in IHFs were 20 to 40% less costly for the identical service, same quality, etc. So what you're seeing is a shift of identical services, so MRI, CT scans, minor surgeries, but hopefully eventually by 2024, according to Ford, even hip and knee replacements, into facilities in which there's greater control over management. You can be a little bit more innovative, not a little bit more, a lot more innovative, because these facilities have to be able to be revenue positive using public dollars. So these are publicly funded services, or they go out of business. Whereas hospitals, no matter how they function, they'll stay in business. They can always apply for another global budget next year.
So, Joanna, one of the reasons Premier Ford has said he wants to make this move is to address backlogs. What can you tell us about how bad backlogs are, perhaps how they've changed during the pandemic, and most importantly, what the consequence of long wait times are on patients and how that might implicate their constitutionally protected rights?
So, by the government's own estimation, there are between 200 and 250,000 people in backlogs waiting for surgeries just in Ontario. We know there have been good studies out of the Fraser Institute that the wait times have gone up, I think, by average of about 4 weeks over the course of the pandemic. So, 4 weeks from already being beyond the medically acceptable guidelines. And these are concerning. Things happen, people's health deteriorates while they're waiting in line. They suffer, painful ailments. Certainly, if you've ever needed a hip replacement or a knee replacement, it's painful. And then most importantly, a freedom of information request that actually you requested showed that there had been a huge surge in waiting times for pediatric surgeries, which are particularly concerning because, of course, they can negatively impact a child's development, negatively impact them for the rest of their lives. So waiting lists are a very serious matter.
Yeah, I mean, the issue with children is because their development is so quick, their bodies change so rapidly, they actually have they're supposed to have shorter wait times than an adult because of the damage waiting for a service can do on a growing body. Dr. Whatley, you're a physician. What can you tell us about the damage long wait times and wait times beyond the medical benchmarks can have on a patient? How important this is?
Well, I think everybody's heard about the narcotic epidemic that we have in Canada. We're some of the highest prescribers per population in the world. And a big part of that is because people are waiting in pain so long for their surgeries. And just building on what Joanna said, this is OMA data. Over 20 million services were backlogged during the pandemic. If we look at CIHI data, over 600,000 fewer procedures were performed in the first 22 months of the pandemic. If you look at benchmarks for wait times, so they suggest that everybody should have their hip replaced within 6 months of the surgeon putting you on the wait list or booking you for surgery. And we used to be able to hit that about 70% of the time. We're now hitting it 62% of the time. But it also begs the question, why are we even looking at 6 months as the benchmark, right? 182 days. So we're very comfortable with incredibly long waits. We're world famous for waits, and those waits have become even longer due to the pandemic.
Dr. Whatley, do you have any information? We've only got about 30 seconds left. Do you have any information on where Canada stands internationally on wait times compared to other countries?
Well, when you look at the wealthiest countries in the world, Commonwealth Fund study, published 2014, 2017, and again in 2021, we're 10th out of 11 countries. That's a global comparison. It's heavily weighted towards weights and costs, but we do very poorly on those measures.
Wow, it's so disappointing to hear that. And I know that basically every Canadian knows somebody who has suffered because they've been on a long wait list. And most of us would do almost anything if we see one of our loved ones waiting in pain. But the government system that we have prevents us from going outside the government system.